In June of 1981, the first case of HIV was discovered, devastating communities across the United States. An unknown disease started killing previously known healthy individuals. Through advances in science and technology, we have made great strides in combating the fight against HIV. While there's still more work to be done, there are many great initiatives, such as the End the HIV Epidemic, a plan for America with a goal of 75% reduction in new HIV infections by 2025 and at least 90% reduction by 2030. Right now, I'm going to take you through the history of HIV in the United States and the advancements in treatment that have taken place this far. So let's get started. In June 1981, a rare lung infection was found in 5 previously healthy men. By that December, the first cases of the lung infection were reported in people who inject drugs. In September of 1982, the CDC used the term AIDS, acquired immune deficiency syndrome, for the first time. A number of AIDS-specific organizations had been set up, including the San Francisco AIDS Foundation in the U.S. At the beginning of 1983, AIDS was reported among female partners of men who had the disease, suggesting it could be passed via heterosexual sex. In May, doctors in France reported a new retrovirus that could be the cause of AIDS. In June, the first reported cases of AIDS in children were announced, suggesting it could be contracted through regular contact, but was disproven and shown to be transmitted during birth. In September, the CDC ruled out transmission of AIDS by casual contact, food, water, air, or surfaces. April of 1984, the National Cancer Institute announced that they found the cause of AIDS, the retrovirus HTLV3. A blood test was then created to screen for the virus, with the hope that a vaccine would be developed in 2 years. By the end of 1984, the U.S. was left with 7,699 AIDS cases and 3,665 AIDS deaths. In 1985, the first commercial blood test, ELISA, was approved by the FDA to detect antibodies to the virus. Ryan White, a teenager from Indiana, acquired AIDS through contaminated blood products used to treat his hemophilia, was banned from school. Blood banks began to screen the U.S. blood supply. In March of 1987, the FDA approved the first antiretroviral drug, AZT, as treatment for HIV. In April, the FDA approved the Western blot test, a more specific HIV antibody test. And in July, the WHO confirmed that HIV could be passed from mother to child during breastfeeding. In 1988, the World Health Organization declared December 1st as the first World AIDS Day. In 1990, Ryan White dies of an AIDS-related illness at 18. And in October, the FDA approved the use of AZT to treat children with AIDS. In 92, the FDA licensed a 10-minute test kit, which would be used by healthcare professionals to detect HIV. Several celebrities had come out stating that they had HIV, including Magic Johnson, Freddie Mercury, and Arthur Ashe by 1992. In 1993, the U.S. Congress voted to ban entry into the country for people living with HIV. In 1994, the FDA approved an oral HIV test, the first non-blood HIV test. Following up in 1996, the FDA approved the first home testing kit and the first HIV urine test. Occupational post-exposure prophylaxis with antiretrovirals to prevent infection has been recommended. By the end of 1997, the FDA approved Combivir, a combination of 2 antiretroviral drugs, taken as a single tablet, making it easier for people living with HIV to take their medication. Ending 2002, the FDA approved the first rapid HIV test with 99.6% accuracy and a result in 20 minutes. The World Health Organization announced the 3x5 initiative to bring HIV treatment to 3 million people by 2005. This was declared in 2003. In 2010, the travel ban was finally lifted that was preventing HIV-positive people from entering the U.S. Also, results from a clinical trial, IPREX, showed a reduction in HIV acquisition of 44% among men who have sex with men and who took pre-exposure prophylaxis. In 2011, the FDA approved Complera, the second all-in-one fixed-dose combination tablet. In July of 2012, the The FDA approved PrEP for HIV-negative people to prevent sexually transmission of HIV, and for the first time, the majority of people eligible for treatment were receiving it. In September of 2015, the World Health Organization released new treatment guidelines recommending that all people living with HIV should receive antiretroviral treatment, regardless of their CD4 count. In 2017, the U equals U, undetectable equals untransmittable campaign was launched. This campaign informs the public of how effective HIV medications are in preventing sexual transmission of HIV. So what has been going on as of today? As of May 2019, the National Institute of Health, or NIH, is currently conducting clinical trials for people who have a hard time taking antiretroviral treatment, or ART, in pill form. This new study is called Long-Acting Therapy to Improve Treatment Success in Daily Life, or simply put, Latitude. For more information on anything mentioned here today, please visit nih.org or cdc.org. I will also put a link to all my resources in the description box below. Thank you for watching.